I will be teaching a lesson on type 1 diabetes. I will be teaching all of you how to provide self-care to the school-age children. And to start, I'm going to pass out a pre-test that you can do before I start the lesson. For the assessment for my self-care, the teaching was mostly created through my clinical practicum and through observation with the school-age children at Hawaiian Gardens Elementary. And I worked closely with the school nurse, Patty DuPont, to develop this teaching. And for this planning portion, the resource and tools that I used was my preceptor, Patty DuPont, which is a school nurse. I also used American Diabetes Association tools for the diabetes trainer, as well as standardized worksheets that were provided by Patty DuPont and by the ABC School District. The pretest was conducted to present teaching objectives and identify any feelings or preferences or values that might impact the learning environment. The teaching was utilized cognitive and psychomotor, the domains of learning, to focus on comprehension and application of the material. The key objectives to this teaching lesson, the participants will be able to define type 1 diabetes, including what causes type 1 diabetes and what is type 1 diabetes. Participants will be able to teach elementary school age children that type 1 diabetes is a lifelong disease, but can be self-managed with exercise, proper nutrition, and medication. Participants will be able to identify the signs and symptoms of low blood sugar and high blood sugar, also known as hypoglycemia and hyperglycemia. Participants will be familiar with the self-care routine, and participants will be able to teach a self-care routine to the school-age children. This is a fun fact. In 2013, the California Supreme Court ruled that California law allows unlicensed individuals to administer insulin care and other prescription medication to students with diabetes. So what does this mean for you? So this is not the sole responsibility of the professional licensed healthcare person to administer insulin or medication in the school setting. So this allows you to be able to, and you are required to administer insulin and the medication for these students. So this is why this is really important for you all to know the process of self-care, and it also helps to teach the school-age children how to manage their own type 1 diabetes, and this will help them when they go off to middle school and adulthood as well. What is type 1 diabetes? Type 1 diabetes is also known as juvenile diabetes or insulin-dependent diabetes. It's also a chronic healthcare condition. Can appear at any age, most common peaks age 4 to 7 and age 10 to 14. Pancreas produces little to no insulin. Insulin is a naturally occurring hormone needed to promote the production of energy through sugar or glucose entering the cells. Type 1 diabetes has no cure as well. What causes type 1 diabetes? The exact cause is unknown. Immune system mistakenly attacks insulin-producing cells in the pancreas. Other possible causes include genetics or exposure to any viruses or environmental factors. Why is this teaching important? Type 1 diabetes is a lifelong disease. Proper management is important. Nutrition, active lifestyle, and exercise, self-care routines, sometimes including medication. In this worksheet, now I'm going to demonstrate a process that a student goes through when they come into the school nurse's office. This is an example of an insulin worksheet, the example of doctor's orders. The student will come in, they will take a lancet, prick their finger, put the strip inside the Novometer, and they will get a reading. For instance, this is an example of a blood glucose reading of 252. Example of a doctor's orders: insulin to carbohydrate ratio 1 unit insulin for every 30 grams of carbohydrate. In this case, 2 units of extra, 2 units extra blood glucose is between 251 and 350. So with the reading shows 252. The sliding scale insulin, which is also called the correction factor, would be 2 units. I will come back to this slide. The next slide I'm going to show you an example that the ABC School Unified School District has provided. It's a recipe carbohydrate list. It's in alphabetical order. You can find pizza and it will give you how many grams of carbohydrate it contains. I will go back to the next slide. And for example, pizza contains 32 grams of carbohydrates, chocolate milk 22 grams, fruit 18. The total carbohydrate reading would be 72. The total carbohydrate divided by 30, 1 unit for every 30 grams of carbohydrate. The student will then round off to the nearest whole. And in this case, number 6 would indicate that you would add number 2, which is the correction factor, the number 2, plus number 5, which is when you round to the nearest whole on the calculator, it would be 2, which 4 units of insulin will be given. And this is the ABC School recipe carbohydrate list. In this image, these are the best places for students to inject themselves. Students should be injecting insulin to a layer of fat directly under the skin. These are areas shown that the slides are places where you are more likely to inject. You will obtain the insulin pen, the dose knob. You will see it in the dose window. The dose knob, you turn it into 4 units, and the student will then inject themselves. Also, remember to teach the child to rotate sides. In this instance, children most likely will inject themselves in the abdomen because it's just easier access for them. Just remind yourselves that it is important to teach the school-age children to rotate sides. That way the underlying tissue won't become irritated. These are images of hypoglycemia and hyperglycemia. Hypoglycemia is also known as low blood sugar. The causes are too little food, too much insulin, or extra exercise. When a school-age child comes in with these symptoms, if it's during their lunch, you would go ahead, have them take their reading, and go ahead and give them their lunch for them to eat. If it's in between recess periods and they come in exhibiting any of these symptoms, you can provide a snack, either 4 ounces of 4 ounces of any type of juice, or you can provide bread. You can also provide a granola bar, peanut butter on bread, or a yogurt. And you will have them retake their blood sugar 15 minutes after the interventions have been done. This is an image of hyperglycemia. And if the student comes in and exhibits any of these symptoms, you take their blood sugar, it's over 300 with symptoms present. You can also test for ketones. Ketones, very easy. You have them urinate in a cup. You dip the stick in, quickly take it out, 15 seconds, compare it to the corresponding chart that's there. And this is an example of a diabetes monitoring log that a school nurse uses, or any of the trained staff uses as well. It would be the date, start time, staff initial, blood glucose level, correction dose, carb count, insulin for carbs, total insulin injection site, if any ketones are present, and you would initial and sign at the end. And this concludes the self-teaching lesson for type 1 diabetes and school-age children. Thank you.